Hi everyone, I am Dr. Jogendra Kumar Bastia. I am a neurophysician. Today I am going to discuss about a new development that is happening in the field of medical science, especially neuroscience. Today I am going to discuss about a newer therapy which is just a decade old therapy and which is gaining popularity very rapidly among the medical fraternity. It is supposed to be a game changer in the field of medical science. It is supposed to be a promising therapy. It is supposed to be a futuristic therapy for numerous medical, psychiatric, and neurological disorders. Why it is promising? Why it is supposed to be game changer? Because it is a therapy which is found to be very, very effective. It is a therapy which is found to be without any side effect. It is a therapy where patients no need to take any injections, any pills, tablets, syrups, no need to get admitted in the hospital. Just come to the OPD, take the therapy, which is just some magnetic pulses, and go home. Get rid of your diseases, get rid of your symptoms, get rid of your medications you are using over the years. So let us start about the discussion. I am going to discuss about Rtms therapy. In this discussion, I am going to explain what is Rtms therapy, what is the principle, how does it works, how it is useful in numerous neurological diseases, numerous psychiatric diseases. So let us start the discussion. Rtms stands for repetitive transcranial magnetic stimulation. It is a non-invasive brain stimulation technique and it is used to treat various neurological and psychiatric conditions. The procedure is done using a specialized device called an Rtms coil. This coil is placed on the skull over the specific targeted brain region. In the figure you can see a coil is placed on the head and it is producing a magnetic field surrounding a specific area of the brain. You can see how a basic Rtms equipment looks like. This is a specialized device used to deliver repetitive transcranial magnetic stimulation therapy. The instrument typically consists of the Rtms coil, which is the most important part. It is directly held over the head and it is responsible for delivering the magnetic pulses onto the brain. It is connected to a stimulator which creates the magnetic field. The stimulator is connected to a cooling system which cools up the system when it becomes heats up after repeated use, and the stimulator is controlled by a control unit which determines with what intensity, what frequency the magnetic pulses should be delivered. This is a Russian-made Rtms instrument called Neurosoft based on Russian technology which we are presently using in our neuro hospital. Rtms therapy involves the use of magnetic fields to stimulate specific areas of the brain. In the figure you can see two red marks. One is prefrontal motor cortex, other is primary motor cortex. These two areas are most frequently targeted in most of the neurological and psychiatric disorders during Rtms therapy. Coming to the basic principle of the therapy, you can see the Rtms coil is placed over the head. This coil is generating a magnetic field. Under the influence of the magnetic field, a current is induced in the brain circuit over a specific targeted area of the brain. As an artificial current is induced in the specific brain circuit under the influence of the magnetic field created by the Rtms coil, that current alters the activity of the neurons in the targeted brain region that leads to changes in the neuronal circuits and neurotransmitter levels. Induced current inside the brain either cause inhibition or facilitation of the underlying neuronal circuit, and that depends upon with which frequency you are giving the magnetic stimulation. If you give a lesser frequency, less than 1 Hz magnetic stimulation, it will cause inhibition of the underlying neuronal circuit. If you give a high frequency magnetic stimulation, means more than 1 Hz magnetic stimulation, it will cause facilitation of the stimulation of the underlying neuronal circuit. In the figure you can see how a normal cerebral activity looks like mixture of yellow-green color. When you give a low frequency stimulation, the second figure, 1 Hz stimulation, that will cause decreasing in cerebral activity marked by more bluish, more greener discoloration. On the other hand, if you give a high frequency magnetic stimulation, just like 20 Hz stimulation, it is increasing the cerebral activity which is marked by more orange, more red discoloration. This inhibition or stimulation of the brain circuits leads to release of different neurotransmitters. This neurotransmitter release is responsible for immediate effect of the Rtms therapy. Whereas there is a long-term potentiation, either there is increasing in number of the brain receptors or decreasing in number of the brain receptor. This alteration in the brain receptor levels are responsible for the long-term effect of the Rtms therapy. Rtms therapy is usually or often used as an alternative to the medications. That means instead of using medications, pills, tablets or injections, you can use Rtms therapy. While in other cases, it is used in combination with the medications or in combination with psychotherapy. It is a outpatient department based procedure. That means you come to the OPD, take the therapy and go home. The duration of each session around 20 to 40 minutes, and the total number of sessions will depend upon which type of disease you are taking this, and also it will vary from individual to individual. Rtms therapy is considered very safe. It is very well tolerated. Few side effects. You can tell there is no side effect. Some people may tell they feel some tapping sensation while the therapy is going on. Some may feel little headache or scalp discomfort during the therapy or just after the therapy. But it is very temporary. It goes away automatically. Rarely you may need some painkiller to relieve it. This is how the therapy is given. He is a patient of brain stroke who is taking Rtms therapy for stroke rehabilitation in our hospital. The best part of this therapy is there is no systemic side effects. As you are not taking any external chemicals, any drugs, injections or medicines inside our body, so there is no chance of any systemic side effects. So this is the most advantage of this therapy. But there is a small disclaimer. Nothing in this world is without any drawback. So what is the drawback in this therapy? Very rarely you may get seizure attack, especially if you are a patient of epilepsy and using multiple antidepressant drugs. Second, there is temporary hearing loss. Why? Because this sound of the magnet, you may feel some hearing loss, but it is very temporary, goes away immediately or automatically. Third is mild headache, as I explained before. Fourth is psychiatric complications. As you give it for depression, some patient may transiently develop some mania, but it is for very short duration and don't need any specific treatment. So whatever the side effects are there, they are temporary without any major concern and they goes away automatically and treatable. Now come to the most important part of the discussion. What are the clinical conditions, neurological psychiatric diseases where we can use Rtms therapy effectively? The most common indication is depression. It has been used in depression over a decade and found to be very effective and without any major concern. There are numerous psychiatric conditions where it has been used very effectively. One is obsessive compulsive disorder, one is auditory hallucinations in schizophrenia patient, for negative symptoms in schizophrenia patient, in post-traumatic stress disorder, in anxiety disorder, in autism, in bipolar depression, in Tourette syndrome. And here comes the different neurological diseases where Rtms therapy has been successfully used. One is Parkinson's disease, second is Alzheimer's disease, which is a disease leads to dementia. That is epilepsy, multiple sclerosis, stroke, multiple chronic pain disorders, in migraine headache, and finally insomnia. In modern medical science, no new therapy is permitted to be used in common clinical practice unless it has been approved by major regulatory bodies in different countries. FDA is the most important drug regulatory body in the world. Since 2008, the FDA has approved Rtms therapy in various clinical conditions after seeing promising results from numerous clinical trials. FDA has approved Rtms for major depressive disorders in 2008, then it approved it for migraine in 2013, approved for obsessive compulsive disorder in 2018, and in same year it approved it for treatment resistant depression. It approved for smoking addiction and some other addictions in 2020, and 2021 it approved Rtms therapy for anxiety disorder. The interesting part is that any patient can use this therapy, either a male or a female, any age, either pregnant or non-pregnant, anyone can use it. But there are some rare conditions where it should be avoided. The major contraindication, if there is a metal in your head, a sharp nail, or a surgical clip, or a welding fragment, these are the metallic substances who will be attracted by the magnetic field. Second is for a patient having a pacemaker or intracardiac device, because the magnet will damage that device. Third, if there is an implant, ocular or cochlear implant, and if there is a medication pump, there are few rare conditions where the Rtms therapy should be avoided, should be contraindicated. The most important and the most successful use of Rtms therapy is depression. It has been approved by regulatory agencies in several countries for the treatment of depression and has shown to be effective in numerous clinical trials and studies. So, if you are a patient of depression and you are taking multiple antidepressant drugs and not getting relief, or a patient of depression and you are afraid of taking medications because of fear of side effect, here is the best option for you. This is how it works in depression. In patients of depression, some areas of the brain are overactive, means the brain activity is too high. You can see marked by the orange and red color. Whereas some other areas where the brain activity is too low. So, through Rtms therapy, the underactive, the less active brain areas are stimulated, and the overactive or high activity brain areas are suppressed through magnetic stimulation. If a patient is taking treatment for depression, during Rtms therapy, he remains awake during whole treatment, no restriction of activities. The duration initially once a day, 5 days in a week for 6 weeks, then twice in a week around for 3 weeks, and the duration of therapy depends upon 20 to 30 minutes depending upon the protocol you are using. In our hospital for depression, we use 8 different Rtms protocols. Depending upon the patient's clinical need, we will decide which protocol we will use for the particular patient. This is a schematic presentation of effect of different type of treatment in patients with treatment resistant depression. First one when you use medication, second one when you use only psychotherapy, there is little response. When you combine the medications and psychotherapy, there is increase in response rate. The final bar, when you combine the psychotherapy, medication, and along with it, when you use Rtms therapy, there is significant increase in response rate. Most of the time, the patient will ask how long this treatment will be effective, how long the effect will last. Interestingly, most of the patient, the effect will last even more than 2 years. After 2 years, they will not need any medications. While some other patients will need some intermittent maintenance Rtms therapy, while some other patient will need some medications or change in their medications. Another important indication is anxiety disorder. If you are a patient of anxiety disorder and you are not willing to take medicines, or you are a patient of anxiety disorder and taking medicine and not getting relief, there is a good option for you. Rtms has shown potential in treating various types of anxiety disorder, especially generalized anxiety disorder and panic disorders. Rtms has shown promise in obsessive compulsive disorder, particularly when used in combination with traditional treatments such as medications and psychotherapy. Now comes the substance abuse disorders. I think it is a nightmare for our present day society. Every alternate family will have a person who is addicted to drugs, cocaine, marijuana, or addicted to tobacco, addicted to smoking, addicted to alcohol, and it is very difficult to treat it. But fortunately, Rtms has been studied as a treatment for addiction and substance abuse disorders with promising results in early research. So, it may be an emerging hope for those having addiction to alcohol, smoking, cocaine, or drugs. Nowadays, because of late age marriage and late age parenting, the incidence of neurological and psychological disorders has significantly increased among the children. ADHD, attention deficit hyperactive disorder, is one of such conditions. Here you will find a child who is having difficulty in getting along, difficulty in concentrating in its study, having forgetfulness, difficulty in sitting quiet, hyperactive, running here and there, difficult to control. These are the symptoms of ADHD, and most of the parents don't want to put their child on medication for the symptoms. Fortunately, Rtms has shown potential in treating these symptoms of ADHD, and particularly in individuals who have not responded to traditional treatments such as medications. Another important clinical condition is chronic pain syndromes. There has been numerous chronic pain syndromes like fibromyalgia syndrome, chronic headaches, migraine, tension type headache, chronic back pain, chronic neck pain, chronic limbs pain, chronic myofascial pain syndromes. These patients basically nightmare for most of the clinicians, and these conditions are also nightmare for the patients because these patients usually don't respond to most of the conventional pain therapies. Here Rtms may be of some hope, but it should be used as an adjunctive therapy along with pain medications and along with other non-pharmacological therapy. Another important use of Rtms therapy is stroke rehabilitation. Stroke patients are those patients having paralysis. One of their limb is not working, not able to speak, not able to walk, having chronic pain. Rtms has been used to enhance stroke rehabilitation by stimulating the brain regions involved in motor function. There have been several clinical trials investigating the use of RTMS in stroke rehabilitation. A systemic review and meta-analysis of these trials published in 2020 found that RTMS therapy was associated with significant improvements in upper limb motor function compared to the sham stimulation or no intervention. In our neurocenter, we have set nearly 10 to 12 different RTMS stroke protocols in our RTMS instrument, and we use different protocols according to the individual patient's clinical need. Thank you for listening this video and for the patience. I hope from this discussion you learn something new. This knowledge will help you, will benefit your friends, your family members when they need it. If you like the video, then press the like button, subscribe the channel so that this type of videos informations will reach to more and more people and it will help them when they need it.